Healthy People 2020 describes health disparities as differences observed in health that are associated with environmental, economic, and/or social disadvantages, such as built environment, water quality, unemployment, lack of socioeconomic mobility, educational attainment, and racial residential segregation. According to the 2008 Georgia Health Disparities Report, Macon County is indicated as one of 15 counties designated as areas with greatest health challenges within the state. Welcome to Macon County. Its borders are drawn from Houston and Marion counties and was drawn in 1837. It is the largest producer of peaches in the state and may have been responsible for Georgia's designation as the Peach State. Macon County is relatively rural. Agriculture and agriculture-related businesses are the background of the Macon County economy. Macon County produces more milk than any other county in Georgia. Poultry has become a major business in the county, and forest products play an important role in the local economy. Weyerhaeuser has a large pulp processing plant near Oglethorpe, the county seat. The leading employers in the county are Macon County Prison, Weyerhaeuser, and Emery's. The County Health Rankings and Roadmaps program provides detailed health information and vital statistics, and also ranked measures of county health in each of the 50 states within the U.S. As of 2016, Macon County had an overall health ranking of 138 out of 159 total counties. According to demographic data reported by County Health Rankings, the total population of Macon County is 13,792. African Americans make up 59.4% of the population, numbering 8,192 persons. Whites account for 34% of the total population, or 4,689 persons. Hispanics comprise 4.1% of the total population, or 565 persons, and Asians make up 1.6, or 220 persons. Pictured here are the summary of results from the 2008 Georgia Health Disparities Report for Macon County. Macon County is a diverse, multicultural, multi-ethnic community, but the summary of findings from the 2008 report gave the county a grade of C for diversity of healthcare providers. Injuries and violence are widespread in society. Both unintentional injuries and those caused by acts of violence are among the top 15 killers for Americans of all ages. The 20 to 29-year age group constitutes the largest portion of the African American population in Macon County. According to the Georgia Department of Public Health OASIS Community Health Needs Assessment Dashboard, the leading cause of death in the 20 to 24-year age group is motor vehicle accidents. For the 25 to 29-year age group, homicide is the leading cause of death. Outside of individual choices, the social environment has notable influence on the risk for injury and violence. Heart disease is the leading cause of death in the United States. Stroke is the third leading cause of death, and almost always preventable. Paralleling the national trend, cardiovascular disease is the leading cause of mortality in Macon County among residents 35 years and older, followed by malignant neoplasms. Ethnic and racial minorities experience a disproportionate burden regarding social, economic, and health factors. Racism continues to play a vital part in American society, which adversely affects minority populations. Inequalities in areas such as in many rural counties, socioeconomic stress is a leading cause in high alcohol consumption and violent attacks. Ethnic minorities, such as African Americans, are fraught by lack of jobs, inadequate income, racial discrimination, and lack of resources. Based on a Minority Rights International, the unemployment rate in African Americans has consistently been about 2 times that of whites since World War II. Education plays a vital role in the challenges faced by minorities. More than 2 million blacks currently attend a school that is 90% populated by people of color. This removes funding, adequate resources, and experienced and certified teachers. Low education attainment by minorities in rural counties result in increased risk of developing diseases due to the lack of knowledge of healthier behavioral practices, inability to effectively read and communicate, inability to advance in employment and social status. Rural counties generally lack sufficient health care facilities and staff, which strains the ability to provide quality care. Most minorities lack health insurance, which limits their visits to a medical professional due to high cost. Rural areas often lack cultural diversity within the healthcare field, causing communication and relatability issues. Racial discrimination from healthcare providers has been shown in minorities receiving less than quality care. Addressing the disparities. The socio-ecological model provides a framework with the capacity to initiate and cement behavior change in dynamic, complex environments. Multi-level intervention strategies are most effective in changing health behaviors by utilizing the factors of the model's various levels. To reduce unintentional injuries among young adults aged 20 to 29, public policy calling for the development of culturally sensitive driving and traffic safety information to be taught in schools, and local community centers, and policy to implement a program similar to the lethality assessment program, which uses law enforcement and service health professionals to assess and identify victims of domestic violence at risk for being killed or gravely injured. For addressing cardiovascular disease and malignant neoplasms among African Americans, public policy advocating for physician cultural sensitivity training programs and culturally focused education and advocacy for colorectal and respiratory screening.